Hi guys, welcome back to my channel, But I'm Strong. As always, thank you for stopping by and viewing my videos. I really do appreciate all of the support. So a few weeks ago, I had a discussion with my neurologist and he explained to me that I have refractory myasthenia gravis. And what that means is that I'm not responding to the normal treatment that's used for patients with myasthenia gravis. He wanted me to see an oncologist and have a consultation regarding trying a new immunotherapy called Rituxan. So the oncologist explains what Rituxan is and how it's used for patients with myasthenia gravis and with patients with autoimmune disorders. He doesn't do a thorough examination. He just does like a small examination of my strength, and you're able to see what my strength is like at my best right now. And I really hope that this video helps, and if you're thinking of trying Rituxan, I hope that this provides a little bit more information for you.
Okay. So awareness is good.
Yes.
All right, arms up, neck up, eyes up at the ceiling. As long as you can, long as you can. All right, I see what you mean with proximal. But neck and eyes look fine.
Yeah.
I know you're tired. Keep doing it as long as you can.
Okay.
As long as you can. Keep them up. I'm going to try and push down. Keep up. Okay. You can rest. Okay. Cheek and stuff. You were trying really hard. Your cheek started to quiver. Okay. The hands look pretty good though. It's more the shoulders, right?
Yeah, the shoulders. Just this hand is a little weak, as you can see. My fingers are a little weak.
Okay. Give me a good squeeze. I'm going to try and pull. Keep. And the other thing we do is, if I put continuous resistance, you probably would do better. But this alternating, this push-pull is actually harder because the muscles have to contract and relax. That's pretty good. How about tapping like this? You're getting a little tired on the right there. Now, each finger. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's pretty good. But I see that you're really working on the right. Okay. Does doing that make you start feeling out of breath too, or no?
Not just that, no. It's
Okay.
mostly when I have to work out my legs. That's when I start to get out of breath.
Okay.
Yeah.
Here we go. So just tap the toes for me. Okay, and lift all the way up. Don't let me push down. Keep those toes up. Okay. Good. Same thing with the knee up in the air. Don't let me push down. Okay. Yeah. Okay. Same thing here. Okay. Good. All right. So today I got to work out. You did too, I think. You did too, but yeah. Okay. That's the other problem too, is that when people examine somebody with myasthenia, even some neurologists, especially like our kids in training, it just seems like they're not trying hard.
Right.
Because you can't. The nerve signal can't get to the muscle.
Just sitting there. Yeah, that's true.
Yeah. So it seems on the other end like we're not really trying. You're
Yeah.
trying.
I know.
You're trying. Okay. All right. So that's the question then, is what to do.
Yeah.
You know, you've been through the standard treatments. The mastodon's always number one, and then usually people get put in prednisone, but we try and use another medicine to replace it, like Imuran or Celsep, and then try and get you off the prednisone. That doesn't work. Then people often go on IVIG, which you've also been doing.
Yep.
And it sounds like they're helping, but you know, you're still having a lot of weakness. And especially having all this leg weakness probably makes it hard to walk and do stuff.
It does.
Yeah.
Yeah, especially with the stairs and walking long distances.
Yeah,
It's
no.
difficult.
Okay.
Yeah.
So then the question is, we don't have any other, you know, approved therapies that have been studied in double-blind, placebo-controlled trials and proven effective. But one thing that we sometimes do, I've also told at one point you did plasma exchange.
Yes, I did last year.
Okay. Did that help or?
No, it didn't. I actually felt worse afterwards.
Okay.
Yeah. It was really difficult treatment.
Okay. Yeah, no, it's not easy.
Yeah, exactly.
All right, but it's always worth a try, because that's kind of the next thing after the standard stuff that we
Right.
also do know works from studies.
Right.
So what they're wondering is whether you might want to try something called Rituximab. Rituximab is not formally FDA approved. It has never been proven effective for myasthenia.
Right.
it's an antibody-based therapy. People may refer to it as chemo. It's not really chemotherapy. It doesn't kill cells other than B cells. It doesn't make you throw up. It doesn't make your hair fall out.
Okay.
Nothing like that.
Okay.
It's an antibody therapy, though, that's used for lymphoma, which is a cancer of B cells.
Okay.
So that's why people refer to it as chemo, because we use it for cancer. Okay? We also use it for a lot of autoimmune disorders where the B cells are part of the problem that are causing antibody production and inflammation and cytokines that are part of the attack, in your case, on the nerve endings of the muscle.
Okay.
There have been some small studies of rituximab for people with refractory myasthenia, people like yourself, that suggest that it probably does help.
Yeah.
But, you know, doctors, we like to think of ourselves as scientists. Some of us are, some of us aren't. We don't, you know, we like proof.
Right.
And the way in this country and most countries in this world that we prove something works is half of people get the real thing and half of people get a fake or a placebo.
Right.
And then we compare them and see, does it really work or not? Because people have been fooled before. Things that we thought worked when they were put to the test just didn't work.
Yeah.
Especially for things, because myasthenia, as you learn, you know, it can come and go on its own. So sometimes you can do something and be like, oh, they got better, but sometimes it just goes away on its own.
Right.
So it's easy to get fooled.
That's true.
So that's the question. Now, rituximab has a number of risks associated with it that you should have on your mind before, especially because we don't have proof that it really does help.
Right.
The common ones are, because it's not something that's normally in the body, like any medicine, you can be allergic to it.
Right.
Anytime you would take it, you know, you would get Tylenol, Benadryl to reduce the risk of allergic reactions.
Right. Okay.
Most of them are mild, you know, itching, some wheezing, runny nose, you know, itchy eyes, but they can be severe. They can be hives. They can even be something called anaphylaxis, which is a life-threatening allergic reaction.
Yeah.
So it has to be done in a monitored setting. If anything like that started to happen, the nurses here are trained. They know how to handle it. But if you had a bad allergic reaction, you cannot get it again.
Exactly, obviously.
Yeah.
Okay.
The serious allergic reactions are pretty rare, honestly.
Okay.
The mild ones, and if we can manage a mild one with Benadryl and maybe a little bit of like hydrocortisone,
Okay.
sometimes we can continue.
Okay.
But that's something to bear in mind, is that this isn't like some of the other medicines you've got. It can have some scary side effects.
Yeah. I was reading on them.
Yeah. Now that being said, most people, the majority of people who get it, feel nothing other than tired and drowsy from the Benadryl.
Right, right.
The good thing about rituximab, it lasts a long time. It lasts 4 to 6 months, so that's good, but that also means once it's in you, we can't reverse the effect. The main thing after allergic reactions that we worry about is that because it suppresses part of your immune system, and especially for you, you're on other immune suppressants,
Yes.
We worry about infections.
Right.
You will get more infections than you otherwise would. Mostly mild, like mild ones, coughs, colds, sinus, ear infections, things that are annoying but not scary.
Okay.
But occasionally people can get scary infections, bad pneumonias, sepsis, which is bacteria in the blood.
Yeah.
You know, and I don't say all this to scare you, I just want us to all be on the same page and know. Especially because, you know, I can't promise you that there's proof that this actually has benefit for you.
Okay.
I think it does.
So I cut the video short there just because we start to go into some more personal stuff about my health. But basically, towards the end of the consultation, he explained to me that, you know, although Rituxan probably in the future will be used as a standard form of treatment for myasthenia gravis, it just hasn't gotten to that point yet. So we both agreed that if there is something else I could do before the Rituxan, to of course try it, and let Rituxan be my treatment of last resort. So I decided not to try the Rituxan just yet and to try another immunosuppressant along with my IVIG to see if that would help with my symptoms, and try that for a while. And if that doesn't work, then maybe in a few months or maybe, you know, sometime next year, I will try the Rituxan. So I hope you found this video helpful. And of course, if you have any questions, please leave them in the comment section and I will respond to them. And if you need any more information regarding Rituxan, please feel free to reach out to me. I will give you all the information that I have. If you have any questions that weren't covered in the video, again, like I said, please leave them down in the comment section and I'll be more than happy to respond. Thank you for watching the video. I look forward to seeing you in the next video. And as always, be blessed and most of all, be strong.